Hello and welcome. I am Dr. Rajarshi Banerjee from Kolkata, India, and today I will tell you briefly about a health education session of health workers which was conducted on the occasion of World Diabetes Day, that is 14th November last year. As you know that India is the diabetes capital of the world, and by 2025 India will have the highest number of diabetics in the world. Health workers are the link between a society and the health system. They work in different interior areas, difficult to reach areas, to provide the benefit of health system to those distant population. The population where the health infrastructure is very poor. Health workers come to the direct contact of public, and common men are more familiar to a health worker than other pillar of a health system like doctor and nurse. That is why this session was organized to train the health worker working in difficult areas regarding the screening of diabetes, which is considered as the most potent silent killer of human civilization. With the help of an NGO working in a village area, a few health workers were invited to attend the session. This session was conducted in the occasion of World Diabetes Day last year, in which we have trained two groups of patients regarding diabetes and obesity. So the session for health worker was named as screening of diabetes. Now what is screening? Now screening is done on healthy subjects, the subjects in whom apparently there is no sign and symptom of disease. But if we screen 100 subjects, healthy subjects, so for blood pressure, so if we measure the blood pressure of 100 subjects, it may be found that 30 or 40 out of them have high blood pressure, but they do not have any sign or symptom of blood pressure. As blood pressure also, high blood pressure or hypertension is also a silent disease. Just like that, we know that diabetes is also a silent disease. That is why we have planned for this session to train the health worker and to find out the prevalence of diabetes in difficult to reach area or interior areas of Bengal. Now, why screening is required for diabetes? We know that the prevalence of diabetes is increasing rapidly. In the year 2014, the worldwide prevalence of diabetes were 387 million, which is thought to increase 592 million by next 20 years. That is, there is a hike of 53%. And another interesting feature of diabetes is that only half of the diabetics are actually aware of their condition. That is, 1 in every 2% diabetic person actually do not know that they are suffering from diabetes. That is why they do not go to doctor, and until very late, when the symptoms of diabetes is very much overt, they need to wait. That is why it is called a silent killer, because it harms the subjects silently inside of their body. Now, what are the risk factors of diabetes? It has a number of risk factors, like sedentary lifestyle. It is one of the most important risk factor of diabetes. Nowadays, in last 2 years, most of us work in office, but from our home. So we need to sit in a chair. We do not go here and there. We do not run or do not walk mostly. So this is an example of sedentary lifestyle. So it is one of the most important risk factor for diabetes. The second important risk factor of diabetes is unhealthy diet. Unhealthy diet means in Indian diet is mostly content of carbohydrate than protein. So it is unhealthy in terms of diabetes, because this large carbohydrate load may lead to diabetes in earlier ages also. Secondly, nowadays we consume mostly junk food, fast food very much in our very fast life. So that is another important risk factor for development of diabetes. Similarly, sweet beverages, ice cream, those foods with high glycemic index increase the risk of diabetes. and those become almost part and parcel of our modern life. Thirdly, obesity. This obesity lead to insulin resistance, and insulin resistance lead to development of type 2 diabetes mellitus. So it is another important risk factor for diabetes. Fourthly, stress. It is another gift of our modern civilization. The stress almost become part and parcel of everyday's life. So this stress is very much linked with the development of diabetes. Fifthly, positive family history. It is related to heredity. If someone in our family has diabetes, then obviously we are at more risk for development of diabetes in our near future. And lastly, age. With the increase of age, mostly after 60 years of age, the risk of development of diabetes is more. Then whom to screen? We need to screen the following population: those with age more than 30 years, those having BMI of 25 or more. In our last session with patient, we taught them how to measure BMI, and all those health workers who participated in this session also were present in those sessions, and they actually supervise and guide the patient to teach them how to measure BMI. So everyone with a BMI, those who are overweight or obese, should go for a screening of diabetes. Thirdly, who have one or more risk factor of diabetes risk factor should go for screening of diabetes, like physical inactivity, as I say, the sedentary lifestyle. Secondly, first degree relative having diabetes, they should also go for a diabetes checkup. Women who have delivered a baby more than 4 kg of weight or who are diagnosed with gestational diabetes mellitus during their pregnancy should go for a diabetes screening checkup. Those with cardiovascular disease in their family should go for a diabetes screening. Fifthly, those whose blood pressure is 140 of systolic, above 140 mm of Hg, systolic blood pressure, and diastolic blood pressure of more than 90 should go for, or taking blood pressure medication should go for diabetes screening. Those having HDL cholesterol less than 35 or triglyceride level more than 250 should go for a diabetes screening. Those with severe obesity also should go for diabetes screening. Those having polycystic ovarian disease in earlier stage of life should go for a diabetes screening. Lastly, those with this skin problem called acanthosis nigricans, that is a thick velvety like skin, should go for a diabetes screening, as it is one of the most important feature or common feature of insulin resistance. And those with this fleshy mass, non-itchy, non-painful mass in the skin called skin tags, those having this thing also should go for a diabetes screening. So all this population should go for a diabetes screening. Now the question is that how to screen. In India, we have one diabetes risk score developed by India Diabetes Research Foundation. In this risk score, there are 5 parameters. The first one is age. So if age of the person is 30 to 44, 10 marks is given to them. If the age is 45 to 59, 18 marks is given. If the age is more than 59 years, that is 60 onwards, 19 marks will be given to the person. Secondly, if there is family history of diabetes, that is any first degree or second degree relative is suffering from diabetes, in that case 7 points will be offered. If the BMI is 25 or more, in that case also 7 points will be offered. If the waist circumference for male, if it is 85 or more than that, or female if it is 80 centimeter or more than that, then 5 marks is offered. And if there is history of sedentary lifestyle, in that case also 4 marks is offered. So total maximum marks is 42. Out of 42, if someone scored 21 or more, then it is considered as high and they need to go test for a oral glucose tolerance test. Now how this oral glucose tolerance test done? In this test, the subject is given 75 milligram of glucose water and glucose to drink, and after that 2 hours from that drink they need to go for a sugar checkup, and if it is 200 or more than that, in that case the person will be labeled as diabetic. Now, in difficult to reach area or distant or very interior area of Bengal, where the lab facility is not there, in those areas, this type of risk score is very much useful, and our health worker, without having a glucometer, without having a lab facility, they can just go to this type of population and can screen them for diabetes. So this is actually very much helpful for them. And if you have a glucometer, in that case, you can check the blood sugar level by the help of glucometer. It is very easy, and by next 6 steps we will teach you how to use this glucometer. Firstly, you need to clean the fingertip, then you need to install the lancet, then you need to insert a strip in the glucometer. After that, you need to need the blood sample, you need to prick the finger with the lancet, and then the blood drop should be touched with the strip, and you have to wait for the glucometer reading. So it is very easy, and also we showed them how to do this by doing a hands-on training by glucometer. And if the blood sugar level is 140 or more, in that case they need to refer the subject to a doctor or healthcare facility for further management of blood sugar. So this way we have conducted the screening session with the health worker, and we also showed them, few of them have a knowledge how to use glucometer and few not. So we showed them by giving hands-on training how to use a glucometer. Thank you.